undertaken by Public Health Wales on sexual health services in Wales. The report rightly praises the sexual health workforce in Wales. The take-up of services has doubled in the last 5 years. This increase undoubtedly will require adjustments and reform to existing services to best meet demand. The key issue is getting these reforms right. I welcome the dramatic reduction in teenage pregnancies between 2010 and 2016. And furthermore, I am sure all in this chamber welcome the continued decline of HIV diagnosis and applaud the Welsh Government's proactive steps to combat the virus. There is still much work to be done to remove the stigma surrounding HIV. However, the high number of people coming forward for testing and campaigns to educate the public on the importance of regular sexual health tests should be celebrated. By increasing accessibility to PrEP, we are moving closer to beating HIV. It is indeed good news that there have been no new cases of the virus in those receiving PrEP. By reducing high-risk sexual behaviour, we take another proactive step to tackling the diagnosis of sexually transmitted diseases. However, Cabinet Secretary, as you highlighted in your statement, diagnosis of other STIs remain high. While we must encourage people to use the preventative measures such as PrEP, they should not be seen as a gateway to high-risk sexual behaviour. Such behaviour, in turn, may expose people to other infections, which consequently may add to the strain on the sexual health services. Dr Giri Shankar of Public Health Wales has stated much work needs to be done on reducing high-risk behaviour. Cabinet Secretary, what specific measures and initiatives do you have planned to respond to Dr Shankar's recommendations for more work in this area? The statement mentions that prisoners are disadvantaged through lack of prison service provision. I find myself having to pause for a thought here. There are already health services in prisons which all prisoners can access. Moreover, prisoners are educated on sexual health during their induction, and they have their own healthcare department, and everyone sees a healthcare specialist professional on a one-to-one basis upon arriving at the prison, and that is mandatory. The statement rightly says that rural communities are disadvantaged through lack of service provision. Cabinet Secretary, could you state what specific and practical measures are being taken to improve access to sexual health services in rural communities? The statement states an aim to implement the Public Health Wales recommendation over a 2-year period. It also states that demand for sexual health services has doubled over a 5-year period and is putting pressure on existing service models. Therefore, what measures will be taken during the transitionary two-year period to ensure that demand for services is met? Online triage is mentioned, but could a full range of online services be implemented more rapidly to cover this 2-year transitionary period? Thank you.
Thank you for those comments and questions. I'm pleased to see a large amount of consistency in issues being raised between the spokespeople. I'll try and briefly cover the issues rather than repeating what I've said in response to both Angela Burns and Rita Yorwith on some of the points. I will, though, remind people that I've already indicated there'll be a plan, it'll be costed, it'll be timetabled about how we'll take that forward. So I won't stand and try and freestyle here now about how that'll be done or the time and speed for it. Otherwise, there'll be pressed to the point in having a group work together to deliver an implementation plan. I was pleased to hear Caroline Jones mention the reality of the stigma of HIV, but more broadly about sexually transmitted infections, and that's still a challenge for us in terms of persuading people both to take seriously their own choices, but also then to seek help at an early enough stage for it to have the best prospect of being successfully treated and managed. And recommendation 9 in the report does refer to sex and relationship education. Now, the review didn't ask them to specifically look at the curriculum review that is taking place. But there's a recognition that's an important tool about how that's done and to make sure that young people growing up in the world are are equipped with a range of information and are able to manage choices that they themselves will make. Although, of course, being an adult is no guarantor of being sensible or reasonable, as I'm sure we all know from various parts of our own lives. And I just want to refer back to the point about inequity and access in provision across the country in a variety of settings. And that is recognised in Recommendation 1 about the reality that we will need to do more. So when we see the plan and the improvement, I would expect health boards to be signed up to and be able to set out in response to that improvement plan how they're going about not just recognising the inequities that already exist, but what they will be doing about those in response to this report, but as I say, the 2-year implementation plan that will be drawn up.
Thank you. Jenny Rathbone.
Thank you, Deputy Presiding Officer. I very warmly welcome your